Okay, I think we're going to get started at this point. So hopefully we are with record. Good evening, everyone. I'm Paz Artaza Regan. I'm the climate organizer at Physicians for Social Responsibility, and welcome to the 5th of the Climate Health Action Team webinar series. Tonight we are delighted to welcome Dr. Alan Lockwood as our main presenter. Also helping out with the webinar and also speaking at the webinar will be Julia Morgan, who is PSR's webmaster. She's going to be our technician for tonight's webinar. And later on, you're going to also hear from Barb Gottlieb, PSR's Director of Environment and Health. Before we get started, let's do a little housekeeping. We're going to be taking questions tonight through both the question box on the right in your box where you'll see about 2/3 of the way down it says questions. You can write there your question. Or you can also use the hand icon that you see over on the top, the little yellow hand. When we're into the question and answer session, you can put your hand up and I will then call on you to ask the question. Please do remember, though, that in order to use that hand symbol, you must either be on the phone or have a microphone on your computer so that you can be heard. But for those that are new to this, the Climate Health Action Team is a new national program that PSR has developed aimed at delivering information, advocacy skills, and guided action to health professionals and other activists so they can help in their states replace fossil fuel-based electricity generation with clean, renewable energy and energy efficiency. The chats have been created to be local state-based in order to strengthen and defend the Clean Power Plan. Today's chat is on how coal kills, the link between air pollution, climate change, and respiratory disease. Last month's chat focused on the issue of natural gas and how it's not a replacement for coal. In that webinar, we did ask getting folks to write to EPA Administrator Gina McCarthy, urging EPA to draft a strong health protective rule that would set limits on methane leaks in gas and oil production. Today, we are celebrating that over 1,900 letters were written by chat members and PSR members to Gina McCarthy, and that is a very good response. Thank you all for that. I also want to now introduce our main speaker, Dr. Alan H. Lockwood. He is an emeritus professor of neurology at the University of Buffalo. He's a graduate of Cornell University and Cornell University Medical College and was trained in neurology at the University of California, San Francisco, with post-residency training in neurochemistry and use of radionuclides at Cornell University Medical College and the Memorial Sloan Kettering Cancer Center. He's board certified in neurology and a member of the American Neurological Association and a fellow of the American Academy of Neurology. He's the author of approximately 220 publications on diverse scientific topics, ranging from hepatic encephalopathy, medical problems of musicians to functioning imaging of the auditory system, tinnitus, and environmental toxicants. He has been an active member of Physicians for Social Responsibility for 3 decades and was president of PSR National in 1994. Currently a member of the board and co-chair of the Environment and Health Committee. And he is the lead author of PSR's report, Coal's Assault on Human Health. Dr. Lockwood is also the author of a new book on coal, The Silent Epidemic, Coal and the Hidden Threat to Health, published by MIT Press. Today he's going to be presenting on how coal kills, the link between air pollution, climate change, and respiratory disease. Dr. Lockwood, I am very pleased and excited to welcome you tonight.
Great, I'm really pleased to be here. And I just show my screen. Hopefully you can all see me now. Well, as has already been said, I'm going to be talking about the links between the Clean Power Plan, burning coal, and respiratory diseases. As I'm sure almost all of you know, the Clean Power Plan is EPA's response to defining carbon dioxide as an atmospheric pollutant, a decision that was upheld by the Supreme Court, giving the EPA the authority and even the mandate to regulate this pollutant, which is the primary driver of climate change. Make no mistake about it, although the Clean Power Plan is really important to make sure that it gets adhered to, it's only an initial step in the right direction. This is not going to solve the problem of climate change, but it is a necessary first step. You know, the journey of 1,000 miles begins with a single step, and this is the step that we're anticipating at the present moment. Now, I always like to begin with a definition of health. Sometimes we forget what it is that we're really all about. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And I think all too often we focus on disease and infirmity when we talk about health. But there really is a broader definition that we need to bear in mind, and I'll come back to this point right at the end of the presentation. Now, as was implied in the introduction, burning coal is one of the most important sources of air pollutants that are responsible for disease in the United States and indeed worldwide. This is a figure that was published in the New York Times last fall and shows the top 10 countries of the world in terms of energy production and how they get their energy. As we see here, the United States gets just under 40% of its energy to generate electricity from burning coal, and other countries like China, almost 80%. Somewhat surprisingly, when you look at the amount of power that's generated from renewable fuels, and this is the area that we want to see growing as time goes by, Brazil is hands down the leader. United States, 9th place. We've got to fix that. In order to make a sustainable energy future, we need sustainable sources of energy. And for those of you out there in the various states on the webinar, this is another figure that was published in the New York Times just a couple of weeks ago that shows how much of the electricity in your individual states is the result of burning coal. Here in New York, 3%. Later on in the presentation by Barb Gottlieb, you'll hear about a proposal from a senator from West Virginia to limit the Clean Power Plan, basically to wipe it out. You'll notice that his state gets 96% of its energy to generate electricity from burning coal. And guess where that senator is likely to get his campaign contributions? This figure shows where the world contributions towards carbon dioxide emissions come from. And it comes from an interesting website called the Global Carbon Atlas. And after the webinar is over, I urge you to go there and look around and poke around and see what you can see, because there's lots of interesting information. This is the curve that is China here, showing pretty gradually increasing CO2 emissions until around 2002, and then they take off, and now they're emitting somewhere around 10,000 megatons of carbon dioxide per year, compared to the United States, which is about half of that amount. So the Clean Power Plan seeks to limit the emissions of carbon dioxide by the U.S. To 30% of historical levels. Now, when the EPA was first getting into the business of thinking seriously about coal, it was asked by Congress to look at the air pollutants that are the result of burning coal. And their analysis came up with over 60 what they refer to as hazardous air pollutants. And these include oxides of sulfur and nitrogen, and I'll come back to them in a few minutes. And particulates, these three are part of what are referred to as the criteria pollutants, for which we have national ambient air quality standards. But there are a bunch of other bad actors here too, including mercury, which is a nervous system toxicant that limits brain growth and development and limits the IQ of children that are exposed to mercury. Now, during the process of preparing the report, Coal's Assault on Human Health, and the book that was subsequently the result of that effort, it became quite evident that the air pollution that's derived from burning coal contributes in an important way to the 4 leading causes of death in the United States. And these are heart disease, malignant neoplasms, not just lung neoplasms, but others as well, respiratory diseases, particularly asthma in children, and stroke. And now there are beginning to be others that are implicated, such as type 2 diabetes and Alzheimer's disease. All of these are important causes of morbidity and mortality in the United States and are costing our healthcare system an enormous amount of money and imperiling the health of virtually everyone in the country. And there's hardly anyone in the audience, I'm sure, who doesn't know someone who's been a victim of one of these diseases. Now, I've mentioned the Clean Air Act before, and one of the important amendments to the Clean Air Act was passed in 1990 and is referred to as the Acid Rain Program. And this gave EPA the authority and indeed the mandate to control emissions of sulfur dioxide and nitrogen oxides. These are criteria pollutants. They're important. They have important negative effects on health. They're pulmonary irritants. And in the atmosphere, they form small particles. And the more we learn about small particles, the nastier it seems that they become. You can see one of the important effects of the acid rain program is a substantial diminution in the emissions of these year by year as this program took effect. And I'll return to this point again in a few minutes. In my estimation, the Clean Air Act and the EPA's actions, including the Clean Power Plan, represent the most important public health steps that have been taken in this country in the last 50 or 75 years. I want to talk a bit about ozone. It too is one of the criteria pollutants, which means that there are federal standards for ozone concentration in the atmosphere. And as you see from this somewhat busy slide, the atmospheric chemistry for ozone formation and degradation is very, very complicated. It depends on ultraviolet light from the sun and heat energy, and as temperatures rise, ozone production is likely to go up. Volatile organic compounds that are both of natural origin as well as man-made origin, such as benzene, toluene, and xylene. Just mention very briefly isoprene, which is a chemical that you may never have heard of before. Trees and other plants spew forth around 500 million tons of isoprene per year. And as atmospheric carbon dioxide concentrations increase, more and more isoprene gets discharged into the atmosphere, and that drives the reactions that form ozone towards making even more ozone. So there are a lot of factors that go into this. Carbon monoxide is also one of the organic compounds that can act as a precursor to ozone, and forest fires are becoming an increasingly important source of this criteria pollutant. The year 2004 happened to be a very bad year for forest fires, particularly in North America. This slide here at the top part, where you see the pointer, shows that there was a very large number of forest fires in Alaska and the western part of Canada. They spewed forth around 66 billion pounds of ozone and increased ground level ozone concentrations by about 25% in Ontario and New York State and the eastern part of the United States. But the effects were felt all the way over to Europe, where ozone concentrations went up by about 10%. It shows that we live in a small world. Forest fires will become more common as lightning strikes go up, as droughts kill off forests, and as pests such as the beetles that infest pine trees kill large numbers of trees. So all of this is very closely related systems. Now, climatologists are in the business, among other things, of trying to predict what the future climate is going to look like. And this includes making predictions about how much ozone there's likely to be in future climate scenarios. And this is one of the really good ones of these models. It predicts so that on average, the daily 1 hour maximum ozone concentration is going to increase by almost 5 parts per billion by the year 2050. The cities with the largest increase will have almost 10 parts per billion increase. And compared to the current standard, which is 75 parts per billion, some 68%, there will be a 68% increase in the number of days where this standard will be increased. And one of the things that EPA is doing is revising this standard, and it's likely to go from 75 down lower to PSR is called for no more than 60 parts per billion. It's more likely, I think, to go to something like 65 or 70 parts per billion. But all of these steps are moves in the right direction that will save lives and improve the health of sensitive populations, particularly children and the elderly. Now, periodically, the Clean Air Act requires the EPA to report to Congress about the benefits and the costs of the Clean Air Act. And you'll hear that the costs are prohibitive. You know, when the Clean Air Act was first passed, one of the first things that was done was to get rid of lead in gasoline. Then we heard Detroit say, well, this is going to be the end of the internal combustion engine. We won't have cars to drive anymore. How are you going to get from A to B? Well, in case you haven't noticed, there's no shortage of cars on the road at the present time. And the Clean Power Plant will not mean an end to electricity. It won't mean an end to electricity that everyone will be able to afford. But what it will mean is that these benefits from the Clean Air Act, which by the year 2020 are estimated to approach $2 trillion per year, will continue to grow much, much faster than the cost of compliance. So here we have a $2 trillion return on a $65 billion annual investment. But it's these people down here that we're asking to spend the $65 billion who hire the K Street lobbyists who go and lobby the members of Congress to block the Clean Power Plan and other aspects of the Clean Air Act. So these are some of the very tangible benefits that we've seen from the Clean Air Act. The acid rain program that I mentioned before that's been cutting cutting oxides of sulfur and nitrogen by about half will result from over 200,000 fewer deaths among adults by 2020, around 7,000 deaths from ozone, mainly in children who won't be dying from asthma, something like 2 million or more cases of asthma, 5.4 million lost days of school attendance, and somewhere around 17 million fewer lost days of work. Now, the new ozone standard is predicted to take full effect by 2025, so that's 5 years beyond this. So we can expect some additional benefits, somewhere between 300,000 and 900,000 fewer asthma attacks, 300,000 to 1 million lost school days, 65,000 to 180,000 missed work days, and somewhere around between 1.4 and 4.3 thousand fewer emergency room visits for asthma. Now, in the last couple of minutes, let me return to this broader definition of health that the World Health Organization proposed. And this is a figure that's taken from the most recent IPCC report. That's the Intergovernmental Panel on Climate Change. And they produced this pie graph here that shows various aspects of health, such as undernutrition, vector-borne diseases, food and waterborne infections, heat-related deaths, air quality, which we've been talking about now. The area in each segment of the pie is proportional to the damage that's being caused in these various sectors, given the present temperature state and the present state of the climate. This is what this graph will look like between 2080 and 2100 if there were to be a 4 degrees centigrade increase in temperatures. This is the business as usual scenario. Now, again, the area in each of these segments of the pie graph represents the impact on health. You see there's a huge increase in all of these areas. Importantly, these reddish areas, or bright orange, are the areas where there are opportunities to mitigate extreme weather, mental health, and violence, and some of the other effects by adapting to an increase in climate. So it's just, these are the opportunities that await us if we take full advantage of the technology that's available to us and that will evolve over the next several decades to reduce carbon dioxide emissions, which is absolutely essential, and to take the measures that are necessary to adapt to an evolving climate. All of these things will result in better health, expenditure of few healthcare dollars, and a better outcome for all of us who live on the world. In a moment, you'll hear from Barb Gottlieb about what you can do specifically with the Clean Power Plant, but this is what we're doing at our home in Buffalo. Again, thanks very much to all of you who tuned in, and I think we go to question and answers now.
Yes, thank you, Alan. At this point, we do go to questions and answers, and I do not see yet anybody having typed in their question. You have that option in the panel on the side where it says question for you to type something, but you also have the option, if you have a microphone or you're using your phone, that I can unmute you, and if you raise your hand, the little yellow icon on the side, if you press on that, I can unmute you, and you are able then to ask your own question. So if anybody has a question, okay, I have one. I'm going to unmute Jack Tuber. At the moment. You are unmuted, Jack. Can you ask your question? Jack? Jack, I believe you're self-muted or something, because I'm not being able to unmute you. Can't get you to ask your question. If you might be able later on to unmute yourself, I'll come back to you. Now I'm going to unmute Maureen McHugh. Maureen, I have unmuted you if you'd like to ask your question.
Benefits of closing some of these plants versus the people who don't want the plants closed. From your crystal ball, how many plants do you really think that will be closed or will be improved, or what do you see coming down the pike for all of this? I know over the last couple of years, coal plants have started to close because of transferring to natural gas, and some of them just because of age and because of other utility, wind and solar coming online. So how do you see this playing out?
Hang on just a second. I'm trying to clean up my screen here. Well, when I first started looking at this issue here, let me put this slide back up. The United States was generating about 50% of its electricity by burning coal. Now it's less than 40. So we're making progress. We're going in the right direction. We live downwind from Ontario. Ontario closed its last coal-fired power plant in March of last year, I believe it was. New York State now is down to 3% of its electricity coming from burning coal, and the other. Things just don't seem to be working here. Forfeit a course. And here you can see on a state-by-state basis. I think the good news is that we're winning the fight to clean up the air and give everyone clean air to breathe, which I think is one of the basic human rights. You have to have access to clean air and clean water in order to be a healthy person. We're moving in the right direction, but there's still a long way to go. And unfortunately, the people who are opposed to the Clean Power Plant are the people who live mainly in the states that are shown up here, like West Virginia, Kentucky, Wyoming, North Dakota, where large amounts of coal are still mined.
Thank you, Alan. At this point, I'm going to move to a question that has been typed in. It's from Andrew Jameton. He says, I appreciate that coal is a cause of many cases of major diseases that contribute heavily to mortality in the U.S. But sometimes the audience has asked me, what proportion of these major diseases is caused by coal? How should I answer this question?
That's a really tough one, and I don't think that we can come up with a very accurate answer. There have been some steps taken in this direction. Permit just a little bit of history here. When the ambient air quality standards were first established, particulate matter was included in that number. And at that time, it was only possible to measure the concentration of those that were 10 millionths of a meter in diameter or greater. Now we routinely measure 2.5 microns, or 2.5 millionths of a meter in diameter. The next step in this process is going to be analyzing the content of the particles and determining the exact origin of the pollutants that we have to deal with on a daily basis. And that will require some additional advances in chemistry. This has been done in a few laboratories. There is a marker, for example, of the particulates that come from coal. They're enriched in selenium, which is one of the metals that is present, not listed under the hazardous air pollutant slide that I showed before, but that's a marker for coal. And in the study that did this segregation that defined particulates as coming from either coal, the transportation sector, or from dust that was stirred up from roads or plowing fields and like, the highest morbidity and mortality was associated with the selenium-containing particles or those that came from coal. So we still have some way to go in terms of analytical chemistry to be able to answer the question directly. But we know that oxides of sulfur and nitrogen and particulates and ozone, carbon monoxide, are all bad for your health. They all come from power plants, and we need to do everything that we can to reduce them.
Okay, I'm moving now to somebody who raised their hand. Stephen Costas, I am going to unmute you so that you can ask your question. Stephen?
Yeah. Yes.
Yes, we can hear you.
Is there a way to outlaw the use of fossil fuels yet?
Well, I mean, theoretically, I suppose the answer to that is yes, but the chances of that happening are about nil. I was a guest of the Irish Asthma Society in early December, and they outlawed what they refer to as smoky coal in Dublin. And that's what we would call that bituminous coal here. And when they did that, they saw an immediate reduction in hospital admissions and deaths that were directly linked to the reductions in the use of what they call smoky coal. So let's
bring it to this country. Let's bring it to this country. Even if get the lawmakers to do it, even the ones in West Virginia, actually make it like a citizen's vote, and if not, make it at least like a citizen's vote, like a ballot and stuff.
Well, why not? I mean, I think the more the people who refer to our efforts as Obama's war on coal hear from people like you, and the more you are in touch with the EPA and tell them that you want better air to breathe for yourself, for your children and grandchildren, if you have any, the more likely we are to make the kind of progress that's needed.
Okay.
Thank you, Stephen. I have now a question that has been typed. It is from Trish O'Day. She says, today I was on a webinar about asthma programs. Attendees were health plans and health professionals. The focus was on home visits and identifying triggers in the home and education about use of inhalers, etc. How can we move the discussion to root causes of many asthma exacerbations? For health professionals to focus on air quality and ozone action days in their community, to ask what is causing this. I find it challenging to get fellow nurses and doctors to look beyond the home and patient behavior in asthma prevention.
Well, we don't talk about treating measles. We talk about preventing measles, and we do that by vaccinating our children. We need to think about, sort of the basic public health messages that it's simpler, cheaper, and more effective to prevent the disease in the first place than it is to treat the sequelae. We've gotten really good at treating diseases, and asthma is no exception to that. I have unpleasant memories of being in the emergency room when I was an intern treating children who were brought in by their parents because they couldn't breathe. The kids were scared to death, so were their parents. And I had a few trembles in my boots as well. It's scary business. But we need to be thinking about prevention. And the way, that's what the Clean Power Plan is all about. It's preventing climate change or keeping it from being as bad as it would be otherwise. And along with that prevention, there needs to be an adaptation. So if the adaptive measures that you have for asthma are taking the medications that are necessary to prevent or abort attacks if you have one. But it's much better to not have asthma in the first place. And that's what we're about.
Right. One more question. We're going to take it now. If we have time at the end, we'll come back to you all that have questions and have your hands raised. This is from Pune Saberi. She wants to know, is there a difference in health impacts between conventional coal extraction and mountaintop removal?
I don't know a direct answer to that. I know, I've flown over parts of West Virginia and Kentucky where they're doing mountaintop removal, and there are really bad things that happen there. Some of the things that are happening is that the prevalence of black lung disease, which is a lung disease that affects coal miners almost selectively, is going up after years and decades of going down. We know that the mountaintop that gets pushed into valley fill, because it's mountaintop valley fill is the whole name of that technique, releases heavy metals like arsenic into the drinking water supplies, and large segments of the drinking water supply in West Virginia now are ruined because the arsenic concentrations are too high to make the drinking water safe for human consumption. So there are certainly bad things that are happening with mountaintop removal.
Thank you, Alan. If we have not gotten to your question, we'll try to get to them at the end, and if we can't get them answered tonight, we will answer them tomorrow morning. We'll send an email to you with the answer. At this point, we're going to move to our action phase of the webinar. This month's action is going to be presented by Barb Gottlieb, PSR's Director of Environment and Health. She is going to be speaking to us as to, now that we've heard this material, what is going to be the action that the group, the chat, the Climate Health Action Team, and other PSR members will be taking during the month. Barb?
Hi, everybody. I'm glad to be with you. Can you see my screen, Haz?
Yes, your screen is visible.
Okay, so let's move ahead. Before I launch into the action that we're taking tonight, let's actually step back a little bit and think again about what the Clean Power Plan is all about and why it's such an important step. The Clean Power Plan is the biggest tool that's available to us at this time in this country to protect us in a broad kind of a way from climate change. So what the Clean Power Plan would do would be to limit carbon dioxide limits from the electricity generation sector. It would set the first ever limits on existing power plants. One of the exciting things about the plan is that it will take place nationwide. So rather than trying to deal with with carbon dioxide on a state-by-state basis, every state in the country except Vermont is going to be asked to meet targets for reducing its carbon. The states have targets set for them by the EPA, but it's up to the states to determine how they're going to meet their targets. So this allows a great deal of flexibility. It allows state politicians, state elected officials, state public utilities to put forth their own views about what's the best path forward for the citizens of their state. There's not a single path that's dictated to them. One of the paths that are available is to greatly increase renewable energy and energy efficiency. That's really where we as PSR members are going to put our energy in the months to come. It's not inevitable. It's not certain that the states will respond to the Clean Power Plan by increasing renewables and energy efficiency. That's where we have to push. Now, as Dr. Lockwood mentioned, the Clean Power Plan alone is not going to get us to where we need to be in terms of safety from climate change. But it's the step that's available, it's the best thing going, and we really have to make sure that it's a success. The Clean Power Plan has not even been finalized yet, and so of course it hasn't been put into effect. But there have been some studies that look at the health impacts that we could anticipate if the Clean Power Plan is put into effect. There was a study released recently by doctors at Harvard, Boston University, and Syracuse University that looked at several different scenarios. And the scenario that most closely resembles what the Clean Power Plan would look like if we relied on renewables and energy efficiency came up with these really startling figures. If the Clean Power Plan were implemented with a reliance on renewables and energy efficiency, we get 3,500 premature deaths avoided each year, 1,000 hospital admissions avoided each year, 220 heart attacks prevented each year. These are pretty substantial gains that we can look forward to. There are, of course, other benefits that are associated with moving on to renewable energy and energy efficiency. So these two areas could create tens of thousands of jobs in American communities. And these are jobs that cannot be offshored, they can't be exported, they're on the ground in the community jobs. Our allies in the environmental field tell us that the clean energy, the Clean Power Plan would also reduce electricity bills for Americans. And then it would also minimize a lot of the harmful activities associated with coal-based electricity generation, like the one just referred to in the last question. So if you're relying on renewable energy, and especially if you're relying on energy efficiency, there's much less mining or extractive activity that's required. You don't have pipeline construction. You're not shipping huge amounts of coal by rail or coal ash. You don't have the generation of coal ash. There are just a lot of gains for health and also for the economy. So that's what we think about when we look at the Clean Power Plan. Other people look at it in different ways. So there are already pieces of legislation being put forth in the U.S. Congress that would virtually gut the Clean Power Plan, even now, before it has been finalized and released. Some of these efforts would go even further and severely weaken the entire Clean Air Act. So what Dr. Lockwood has been referring to has covered not just the Clean Power Plan, but many of the other benefits brought to us by the Clean Air Act. These are the kinds of things that the attacks being introduced in both the U.S. House of Representatives and the Senate would unleash on us. So I want to run you through just a few of the particulars of the implications or the possible outcomes of a Senate bill that was introduced by Senator Capito, who's a relatively new senator from the state of West Virginia. As Dr. Lockwood pointed out, that's a state that's about 96% dependent on coal for generating its electricity. And it's also a state where there remains a significant number of jobs generated from coal mining, although as the supporters of coal don't generally tend to tell you, that number is declining every year. So here's some of the things that the capital bill would do. And again, this is only one bill that's attacking the Clean Power Plan. There are more. So one of the things this bill would do is to weaken the Clean Air Act. Today, the Clean Air Act sets standards that assumes that there would be improvements in air quality based on using the best demonstrated controls. So they're talking about technological controls on air pollutants that are currently available and affordable. This is the approach that the EPA has used for about 45 years for setting its technology-based standards for cleaning up the air. Well, Senator Capito's bill would block the EPA from finalizing its proposed standards. It would limit standards for new coal plants, that is, coal plants to be built, to the pollution level of today's dirty plants. And since the future standards that will be established for existing coal-fired power plants will be based on those set for new plants, we would also be limiting our ability to set standards for existing plants. So we would be hog-tying our ability to apply technology to clean up the air. Another thing that the Capito bill would do would be to block the implementation of the Clean Power Plan until all related lawsuits were resolved. Now, nowadays, the courts can postpone the implementation of a rule. In order to do that, the people who put forward a lawsuit have to show that they would suffer, quote, quote, irreparable harm if the rule were implemented. They also have to show that if, based on the evidence that they have, they're actually pretty likely to win the lawsuit. So there's something of a bar established there. Senator Capito's bill is different. It would automatically stop implementation, prevent implementation of the Clean Power Plan until all related lawsuits were resolved. We've never seen anything like this. This is totally new. We've had how many decades of the Clean Air Act, and this approach has never even been proposed. So this would indefinitely delay the Clean Power Plan from being implemented because, of course, as you can imagine, there could be an endless stream of lawsuits. They wouldn't have to be sturdy and robust. They wouldn't have to show that they were likely to be won. But if they existed, they would stop the Clean Power Plan. Pretty outrageous. The third point is that the Capito bill would destroy the kind of backstopping that's built into the Clean Power Plan that would make it work. So now and you know what, I'm sorry, I see that my slide says that makes the Clean Air Act work. I think I should have written the Clean Power Plan. So nowadays, the states design the implementation plan, or else the states can refuse to design an implementation plan, and if they do that, the federal government will step in and say, okay, we'll design one for you. Obviously, it's an incentive for the states to come up with their own plan. Under Senator Capito's bill, governors would have the option of refusing to participate. They would simply say, we don't want to participate in the Clean Power Plan. That means there would effectively be no pollution controls set on coal-fired power plants, and no way to protect communities either from their carbon pollution or from the co-benefits of reducing the traditional pollutants. So that's an example of what one legislative assault on the Clean Power Plan would lead to. As I said, there are others. There's a similar bill in the House, and there are more coming in the pipeline. So what I'd like to ask all of you to do is to write your U.S. senators and reject all legislation that would undercut or weaken the Clean Power Plan, that would allow power plants to keep on emitting unlimited amounts of CO2 into the atmosphere, furthering climate change, furthering the whole series, the whole suite of health impacts, and putting us at risk of heat events, extreme weather events, and all the other impacts of climate change on health. We have prepared a letter for you that you can find on the PSR website. The URL for that letter is psr.org/support-CPP, and we will email this link to you tomorrow. If you can write your letter tonight, that's great. If you can write your letter tomorrow, that's great. If you can't, the one thing I'd ask you to do is to set a date by which you will send this letter to your 2 senators. I was on Capitol Hill yesterday with several PSR doctors as well as advocates from other organizations, and we were happy to meet with the senators. A number of them are definitely straddling the fence on this issue. It's really important for them to hear your voices. I'll stop now and just see if there are any questions about this action.
Barbara, there is one from Joanne Leovy. She wants to know where you got your figures for the reduced deaths and morbidities.
Those figures estimating the potential impacts on health of implementation of the Clean Power Plan were issued in a study sponsored by researchers at Harvard, Boston University, and Syracuse University. One of those researchers is Dr. Jonathan Levy, who was actually a PSR member and very graciously presented the background to this study to PSR members back in November, even before the findings were published. I believe that the webinar that he presented is available on the PSR website. So I'd urge you to go to psr.org and search perhaps for Jonathan Levy.
Yes, it is up, and if they can't find it, they can email me or call us, and we'll be able to show them where it is.
Maybe tomorrow, when we send out the link for the action, we can also send out the link to that webinar.
Perfect idea. I don't see any other questions for the action part, so at this point I'm going to go back to some of the folks that were waiting for their questions for Dr. Lockwood. I'm going to unmute Maureen because she's had her hand up for a while. Let's see. Maureen, can you now speak? You had a question?
Sure. Actually, I didn't realize I had my hand up, but I did have a question. As we know, some of these senators, and I come from, unfortunately, a state with 2 red senators, you know, kind of, they fudge around a lot and talk about, well, we do have a lot of clean energy, so pretending almost like the coal doesn't exist. And so I was wondering if on your list of things to do, if people get really unsatisfactory responses from their senators, if you were going to talk at any point about divesting from fossil fuels.
I can respond to that. PSR is looking at the whole suite of actions related to divestment. This is something that we agreed to do in our strategic plan that we arrived at last November. One of the things that was decided just last week by the Environment and Health Committee is that we're going to be participating in a petition campaign which is focusing on the Gates Foundation, the largest foundation in the world, and asking them to divest. This is a campaign that's already underway. It'll be very easy for us to participate in. And it will be a really good measure for us of how much interest and enthusiasm there is for divestment activity. And on the basis of that, we'll be looking into other options. Another option that we're looking at right now is collaboration with Healthcare Without Harm, which is helping hospitals and other healthcare institutions divest their holdings. And they have asked us to provide speakers on the impacts of coal combustion on human health. So we look forward to collaborating with them, and we'll be looking into other possible ways of promoting divestment.
Great. Great, thank you. I think we have time for another one or two questions. This one comes from Jan Boudart. She wants to know, does the burning of fossil fuels increase the amount of radioactive isotopes in the atmosphere? And is this considered a factor in the cause of the list of fossil fuel diseases? Is it particularly implicated as a cause of cancer?
I'll take that. This is Alan Lockwood. If I had control of the screen again, I could put that hazardous air pollutants slide back up again. There are small amounts of uranium and thorium in all coals, and the uranium and thorium find their way not only into the exhaust that comes out of the smokestacks of the power plant, but also, like all of these others, ironically, as the pollution control devices get better, the coal combustion waste or coal ash gets more toxic, so it gets to be more uranium and thorium in the coal combustion waste. If you're not burning coal, you're not doing that, though.
I think this may be second to last question. It is a question that's coming from Vishnu Lalitha Surapaneni. They want to know, on a global scale, since China is the largest producer of CO2, what can PSR do to help decrease Chinese emissions? Or is an idea of setting global standards for clean air a possibility?
Well, if you remember back in, this is the slide showing carbon dioxide emissions here, and this is China. This is the United States. Back in the fall, President Obama met with his counterparts in China and agreed on a joint strategy to mutually reduce CO2 emissions. China's got an even bigger job than we do in terms of cleaning up its air. Make no mistake about it, it's not a backward country. They're spending more on research and development than we are in the United States now, according to some sources. And meanwhile, while Congress cuts budgets to organizations like the National Institutes of Health and the National Science Foundation, China is forging ahead. So we do need to worry about China, but we need to worry about the United States as well. And we need to support the president in his efforts to have discussions with leaders of other countries to move in directions that are mutually beneficial. Today the president played the national security card, and I saw a video of him on the NewsHour tonight where he said that, if you're opposed to if you're opposed to controlling the climate, that's a step in the wrong direction in terms of national security.
Thank you, Alan. The last question is from Claire Gervais. She wanted to know, I think it's a question that kind of sets it up for future webinars. Given that there's so much climate denial, what is an effective strategy to address the issue with the deniers?
Well, one of the interesting developments, I think, that we need to foster, and we need to turn to allies in the faith-based community, is to make this a moral issue, that we have inherited this planet from a creator, or so some people believe. In order to be good stewards of this planet, we need to keep the air quality high, we need to keep the water quality high. We don't need to trash the planet that we live on, which is exactly what we're doing right now. So there are people, including, we're expecting a papal encyclical about climate change later this year. These are all excellent opportunities to approach people who may have a completely different political orientation than we do on some of the social issues, but to be able to talk to them about things that they're interested in. Almost everybody is interested in having good health for themselves, their children, and their grandchildren. So I think as healthcare professionals, we have an important role to play in that area, and we can take advantage and form new alliances with people that we may not have worked with before.
Exactly. Thank you so much, Dr. Lockwood, for the presentation and for the very insightful answers to the questions. At this point, we're going to move forward looking towards next month's webinar. I think there's a slide that should be coming up with the information for next month's webinar. Next month's webinar is going to be on wind power, the clean, efficient, and healthy. It is scheduled for Wednesday, June 17th from 8 to 9 p.m. Please come back to learn about wind power and how to make it one of the linchpins of the Clean Power Plan and for Energy Future. This webinar has been recorded. It will be up on PSR's website sometime tomorrow, as well as the slides. So I invite you to share it once it goes up. And do not hesitate to contact us at PSR regarding questions or concerns about the content of the webinar, how to connect with a local climate health action team in your local area or state, or any other climate change or clean energy question. At this point, I thank all of you for being with us tonight, and see you next month. See you also when you take your actions. I want to also thank all the Climate Health Action Team leaders that have been instrumental in getting the 1,900 actions this past month. I thank you all for that. Good night. See you on June 17th.
Good night, everyone.